This content is for informational and educational purposes only and is not medical advice. Bioregulators and peptides are not approved by the FDA for the treatment or prevention of disease, and you should always consult a qualified healthcare professional before making any changes to your health routine. Today, we're taking the conversation a step further and getting into the practical side of thyroid bioregulators, what they are, which ones are commonly used, and how people typically think about stacking them to support metabolism, energy, and hormone balance. If you listened to the previous episode, you already understand the foundation. The thyroid is your metabolic control center. It influences how your body produces energy, how you burn fuel, and how your entire hormonal system communicates. Now we're layering in the tools. When people talk about thyroid bioregulators, the primary one that comes up is thyrogen. This is considered a thyroid-specific bioregulator, meaning it's derived from peptides associated with thyroid tissue and is designed to support the function of the thyroid gland at the cellular level. The goal here is not to replace thyroid hormone. It's to support how the thyroid cells themselves function, how they respond to signals, and how they contribute to overall hormonal balance. Think of it as supporting the hardware, not just adjusting the output. Now, thyrogen is often used on its own, but more commonly, people look at it as part of a broader stack because the thyroid doesn't operate in isolation. It communicates constantly with the brain, specifically the hypothalamus and the pituitary gland, in what's known as the HPT axis. If that communication is off, the thyroid won't function optimally no matter what you do directly to it. That's where something like pineolin comes in. Pineolin is considered a brain support bioregulator, and it's often used to support hypothalamic signaling. Since the hypothalamus is responsible for initiating the signals that tell the thyroid what to do, supporting this level of the system can improve overall regulation. So now, instead of just supporting the thyroid itself, you're supporting the communication pathway. Another commonly used bioregulator is endolytin. Endolytin is associated with the pineal gland, which plays a role in circadian rhythm and overall hormonal timing. This might not sound directly related to the thyroid at first, but your hormone system is highly dependent on rhythm and timing. If your circadian rhythm is off, your cortisol rhythm is off. If your cortisol rhythm is off, your thyroid signaling can be affected. So endolytin is often used as a way to support that broader endocrine balance. Then you have Visagen. Visagen is more focused on vascular health, specifically supporting blood vessels and microcirculation. This matters because your thyroid, like any organ, depends on proper blood flow to receive nutrients and oxygen. If circulation is compromised, even slightly, it can affect how well the thyroid functions. So adding Visagen into a stack is more about supporting the environment around the thyroid. Now, when people think about stacking these, it's not about taking everything at once randomly. It's about understanding what layer of the system you're trying to support. If someone is primarily dealing with low energy, sluggish metabolism, and signs that point toward underactive thyroid function, they might focus on thyrogen as the base. If brain fog, stress, or poor signaling seems to be a factor, adding pineolin can make sense because now you're addressing the upstream communication. If sleep, rhythm, or hormonal timing is off, endolytin can be layered in to support that regulatory pattern. And if there are concerns about circulation, recovery, or overall tissue support, Visagen can be added to round things out. So instead of thinking in terms of one magic solution, you're thinking in terms of a system. Thyroid, brain, rhythm, circulation. Each piece plays a role. Now, let's talk about metabolism again, but from a practical standpoint. When people say their metabolism is slow, what they're usually experiencing is inefficient energy production. Their body is not converting fuel into usable energy effectively. This can show up as weight gain, fatigue, difficulty losing fat, or feeling like their body just isn't responding the way it used to. Supporting the thyroid can help improve metabolic signaling, but it's also important to remember that metabolism is influenced by multiple factors. Nutrition matters. If you're not getting enough iodine, selenium, or zinc, your thyroid can't function properly. Stress matters. Chronic stress can suppress thyroid function and alter hormone conversion. Sleep matters. Poor sleep disrupts hormonal rhythms and energy production. Bioregulators can support the system, but they work best when the foundation is solid. Now, let's talk about energy in a more real-world sense. There's a difference between being stimulated and being energized. Caffeine can stimulate you, but it doesn't fix the underlying issue if your cells aren't producing energy efficiently. True energy comes from mitochondrial function, from your cells producing ADP consistently throughout the day. When the thyroid is functioning well, it supports that process. When it's not, everything slows down. People who use thyroid bioregulators often report that their energy feels more stable, not necessarily higher in a dramatic way, but more consistent. Less crashing, less relying on stimulants, more of a steady baseline. That's what you're aiming for. Now let's touch on hormones because this is where things can get complex. The thyroid interacts with your adrenal system, your sex hormones, and your metabolic hormones. If your thyroid is underactive, it can contribute to higher cortisol levels, which can lead to stress, fat storage, and fatigue. It can also affect estrogen and progesterone balance, which can impact mood, cycles, and overall well-being. And it can influence insulin sensitivity, which ties back into metabolism and energy. So when you support the thyroid, you're often indirectly supporting these other systems. That's why people sometimes notice changes beyond just energy or weight. They might notice better mood, better sleep, more stable hormones overall. But again, it's not about forcing a change. It's about supporting the system so it can regulate itself more effectively. One thing that's important to understand is that responses can vary. Some people notice subtle changes. Others notice more significant shifts. And some may not notice much at all, especially if there are other underlying issues that need to be addressed. This is not a one-size-fits-all situation. It's a tool, not a guarantee. Another factor is consistency. These types of approaches tend to work over time, not overnight. They're about supporting cellular function, which is a gradual process. Patience matters here. Now, let's bring this all together. If you're thinking about thyroid support, start by understanding your symptoms and your overall health picture. Are you dealing with low energy, slow metabolism, brain fog, or hormonal imbalance? From there, you can think about which layer of the system might need support. Thyroid itself, communication from the brain, hormonal rhythm, or circulation. And then you build from there, keeping everything as simple and intentional as possible. More is not always better. Targeted and consistent is better. This content is for informational and educational purposes only and is not medical advice. Always consult a qualified healthcare professional before starting any new supplement, peptide, or therapy, especially if you have an existing medical condition or are taking medications. Thanks for listening, keep learning, and stay curious.